Shelley House, family nurse practitioner and a provider for Call on Doc. Let's talk symptoms of COVID-19. Probably going to feel like the flu, but there are some very key symptoms that are different than the flu. So let's start with headache. The flu occasionally has a headache with it too. Fever. Also, who may have a fever? Cough. This is one that is very distinct. With COVID, it is a dry cough. It's that hacky cough, typically up in the top. Doesn't sound very good, but you're not bringing anything up with it. Flu, it's a mucousy, wet cough, and it sounds really awful. Sore throat. This is also a key indicator of COVID versus flu. Very rarely with the flu do you have a sore throat. With COVID, almost always. Runny nose. In COVID, typically this is post-nasal drip. It goes to the back, whereas the flu typically comes forward and wants to come out. But you may have that also in COVID, so it's a hit or miss there. The loss of taste or smell. And this may occur with a runny nose or without a runny nose, and this is very distinct of COVID-19. But when should you expect to get symptoms? Typically 2 to 14 days after you have been exposed. And this is because of the viral load. So viral load means it's kind of like a mountain, okay? Is the virus has hit your body, you got these little people and they're just kind of moving along. And then they gather some more people and they keep moving along on their journey. And then they make some more people. And the next day, there's a mountain. They all have to go up this hill. And as they go up this mountain, they're gathering more people. They get to the very top of the mountain. Everybody says, yay, we have made it to the top of the mountain. We have as many people as we need for COVID-19. This is probably where you feel the absolute worst. The next day, time to go down the mountain. Some of those people died off, decided they're going to stay at the top of that mountain. So you start traveling down the mountain. And this typically happens about 5 days. In 7 days in, travel down the mountain. A few more decide they like their view, they're going to stay a little bit more. By the time you get to the bottom, almost everybody is gone. But the upside is you now have an antibody against that particular strand of COVID-19. And that's how a virus runs. So typically we say if your virus or cold goes beyond that 10 to 14 day mark, or if it's gotten worse, then it's time to seek treatment.